Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Pituitary adenomas, we're looking at the classification as well as the associated syndromes. So to begin with, we're looking at the adenoma cell origin. So first is the lactotroph. So what is the hormone involved with the lactotroph? It is nothing but the prolactin. So the prolactin hormone is involved here. And what will be the clinical features? By CF we mean the clinical features. So it includes there is presence of the galactorrhea. So there's presence of galactorrhea as well as the amenorrhea. So there's galactorrhea as well as amenorrhea, and this is in females. Next is the presence of the sexual dysfunction. There is also the sexual dysfunction and the presence of the infertility. Then we look into the gonadotroph. So what is special about gonadotroph? The hormones involved here are the FSH, the LH as well as SLH subunits. So what is the clinical feature here? There is a hypogonadism, presence of the mass effects, and also the hypopituitarism. There is hypogonadism, there is mass effects as well as the hypopituitarism. Next is we deal with the somatotroph. So in terms of the somatotroph, the hormone involved is the GH, that is the growth hormone. So the clinical features, it involves a gigantism. So gigantism is involved, and this is mainly in terms of the children. And then when you look, there is also the acromegaly. Acromegaly is taking place in terms of the adults. This is the somatotroph. Next we look at the corticotroph. So corticotroph, the hormone involved here is nothing but the ACTH. And what is the clinical feature? The clinical feature is nothing but the presence of the Cushing disease. There is presence of the Cushing's disease as well as the Nelson syndrome. So all this is associated with the corticotroph. The hormone involved ACTH. Next we look at the mammosomatotrof. So the mammosomatotrof. So mammosomatotrof, the hormone involved here is the prolactin. So there is prolactin as well as the growth hormone. So what is the clinical feature? The clinical feature is that it involves the hypogonadism. So this hypogonadism as well as there is galactorrhea, and there is also presence of the acromegaly. So this hypogonadism, there is galactorrhea as well as presence of acromegaly. Lastly, we look at the thyrotroph. So the thyrotroph is the hormone which is involved is nothing but the TSH. And what is the clinical features of the thyrotroph? It is the hyperthyroidism. The clinical feature is nothing but the presence of the hyperthyroidism. To learn and grow daily like this, please do subscribe.